Action.
This station is designed to test your ability to perform a patient assessment of a victim of multi-system trauma and voice. Treat all conditions and injuries discovered. You must conduct your assessment as you would in the field, including communicating with your patient. You may remove the patient's clothing down to the shorts or swimsuit if you feel it is necessary. As you conduct your assessment, you should state everything you are assessing. Clinical information not obtainable by visual or physical inspection will be given to you after you demonstrate how it would normally gain that information. You may assume that you have two MTs working with you and that they are correctly carrying out verbal treatments you indicate. You have 10 minutes to complete this skill station. Do you have any questions?
No.
You respond priority 1 to the scene of a MVA. You have an 18-year-old male patient ejected from the vehicle. He is as you find him here. Your time begins when you start.
Okay. My BSI is on. Is my scene safe?
Yes.
Is this my only patient?
Yes.
My mechanism of injury is he was ejected from a motor vehicle collision. It's a significant mechanism of injury, so I'm going to go ahead and call for ALS ambulance and call for a helicopter. I'm going to have one of my trained assistants take and maintain inline stabilization of the spine. What's my general impression of the patient?
He looks bad.
He looks bad. At this point, I'm going to come up, hey buddy, are you okay? Are you okay? Does he respond to that?
No response.
I'm going to pinch an earlobe, do a sternal rub. Do I notice any response?
No response.
Okay, my patient is unresponsive secondary to trauma. This time I'm going to have my partner open the airway with a jaw thrust. I'm going to look, listen, and feel for breathing. Is my patient breathing?
Yes.
What is the rate and quality?
25 in labor.
I am going to place my patient on 15 liters O2 via non-rebreather mask. I'm going to expose the chest. Do I notice any major wounds to the chest?
You have a bruise to the right chest wall.
Okay, do I have paradoxical respirations with this bruise?
Yes.
Okay, I'm going to tape down a large bulky dressing on the patient's exhalation. Do I get adequate ventilation with that?
Yes.
Okay, I'm going to check a carotid and a radial pulse. Does the patient have a pulse?
Yes.
What is the rate and quality?
140 weak and rapid.
Okay, at this point I'm going to completely expose the patient. Do I see any bright spurting hemorrhage?
You see bright spurting hemorrhage coming from your left tib fib.
Okay, I'm going to cover that with a gloved hand. Does that control the bleeding?
No, it doesn't.
I'm going to apply pressure dressing. Does that control the bleeding?
No, it doesn't.
I'm going to apply a second pressure dressing. Does that control the bleeding?
No, it doesn't.
I'm going to apply a third pressure dressing. Does that control the bleeding?
No, it doesn't.
At this point, the next step would be to elevate, but because of the potential for a spinal injury, I'm not going to elevate the appendage. I am going to apply pressure to the pressure point. Does that control the bleeding?
Yes, it does.
I'm going to pass that off to another partner and have him continue holding pressure on that artery. What is my skin color temperature condition?
Pale, cool, flaming diaphragm.
Okay. My patient is a priority patient. He's a candidate for rapid transport. I'm going to do a rapid trauma assessment. At this time, I'm going to check a blood pressure.
80/40.
Is there anyone here who can give me a sample history on this patient?
No.
Okay. At this point, I'm going to start my assessment. I'm going to palpate the cranium for decap BTLS. I'm going to palpate the top and back of the cranium. Do I notice any blood on my gloves, any injuries?
No.
Okay. I'm going to look in and behind both ears. Do I notice anything?
You have a bruise behind both ears.
I'm going to note that. I'm then going to move to the forehead. Do I notice anything on the forehead?
You have a laceration.
Is there major bleeding coming from it?
No.
Okay, if we've got time, I'm going to have one of my partners put a dressing on that. I'm going to palpate the forehead, the orbits, the zygomatic arches, the maxilla, and the mandible. Do I notice anything?
No.
I'm going to check the pupils.
One is dilated.
I'm going to note that. I'm going to remove the oxygen mask. I'm going to look in the nose, look in the mouth. Do I notice anything?
No.
I'm going to replace the oxygen mask. I'm now going to move down to the neck. I'm going to palpate the neck for decap BTLS. Look at my gloves for blood. Do I notice anything?
No.
I'm going to look at the neck for tracheal deviation, JVD, medical alert tags. Do I notice anything?
No.
All right, I'm going to apply a C-collar. I'm now going to have my other trained assistant come help me, and we're going to log roll the patient onto a spine board. Thank you very much. If you don't mind, if you'll put a hand here and a hand here. On the headman's count of 3, we're going to log roll him over. 1, 2, 3. At this time, I'm going to palpate the back of the head, back of the respiratory center, back of the back, buttocks, lower legs. Do I notice anything?
No.
I'm going to slide in a long spine board on the headman's count of 3. We're going to log roll him back onto the board.
1, 2, 3.
All right, at this point, I'm going to secure my patient to the long spine board, torso, and head. We are going to load him into the back of the truck and get en route to the hospital. We're now en route to the hospital or to my backup. I'm going to come back up and I'm going to start palpating the chest. I'm going to palpate down both sides of the chest.
You feel crepitus on the right side.
Underneath my big bulky dressing?
Yes.
I'll note that. I'm going to auscultate the lung fields.
You're clear.
Clear. I'm going to palpate the 4 quadrants of the abdomen. Do I notice anything?
You've got a hot and rigid abdomen.
I'm going to note that. I'm going to do a pelvic rock.
It's stable.
Pelvis is stable. I'm going to check the genitalia for bleeding and priapism.
None noted.
Okay. I'm going to move down to the left leg. I'm going to go all the way around, all the way down, checking my gloves for blood.
You've got crepitus to the left tib fin.
Underneath my pressure dressing. At this point, he's already secured to the spine board, so I'm just going to splint it to the board. I'm going to move to the other leg, all the way around, all the way down. Look at my gloves for blood. Do I notice anything?
No.
I'm going to check bilateral pulses and check, can you feel this? Can you move?
No.
Any response? No response. All right, next I'm going to move up and I'm going to move to the upper extremities. I'm going to palpate the clavicles, the scapulas. I'm going to move down this arm all the way around, all the way down. Notice any blood or any injuries?
No.
Okay. I'm going to move to this other arm all the way around, all the way down. Do I notice anything?
No.
Okay. Bilateral pulses.
Yes.
Can you feel this? Can you move it?
No.
No response. All right. At this point, I am going to recheck his level of consciousness. Squeeze an earlobe, sternal rub.
He groans.
Okay. I'm going to note that. Is the patient still breathing?
Yes.
What's the rate and quality?
It's 20 non-labor.
Okay. Does he have a pulse?
Yes.
What's the rate and quality?
110 full and regular.
Okay. My blood pressure?
100/70.
Okay. Skin still pale, cool, and clammy?
Yes.
Okay. I'm going to recheck my oxygen. Is it still running?
Yes.
I'm going to recheck my bulky dressing to the chest. Is it still in place?
Yes.
I'm going to recheck my arterial bleed. Is it still controlled?
Yes.
Okay. I'm going to recheck my spinal immobilization. Is he still secured to the board?
Yes. Yes.
At this point, treating for shock, I will elevate the foot of the board. I will also cover him with a blanket, and I will continue to monitor my patient en route to the hospital.